Sawasdee krap. Good afternoon once again. Today is Monday, the 27th of December 2021, and this is, as always, the English language summary of the press briefing here at the Center for COVID Situation Administration, or CCSA, here in Thailand. So we're heading towards the last week of the year. Of course, our holiday greetings to all the English language audience in Thailand, or those viewing us on social media from around the world as well. And thank you, Dr. Apisamai, for the Thai language version of the briefing just now. Now, she ended with a very important note about the New Year holiday or break that we'll all be having very soon. As it is a time for celebration, it's a time for family and friends to get together. With the current situation around the world, of course, it is also time for us to be very, very vigilant. Especially here in Thailand, we have lessons learned, of course. We've passed through the New Year celebrations last year and other festivities like Songkran holiday, and during the summer, of course, wherein these festivities and holidays posed as a risk to the country in terms of a surge of the COVID-19 pandemic and increase in infections. So therefore, this coming holiday, this coming New Year weekend, I hope that everyone here listening will be very, very vigilant so that we will be able to fend off any further spread of COVID-19 in the country. I'll start off with a recap of the CCSA daily meeting this morning. As usual, this morning we reviewed the disease control measures being implemented by other countries to learn about the best practices that could be applied to Thailand. The meeting this morning also noted the recommendation in France that adults receive the booster vaccination 3 months after their initial jabs, a reduction from the initial 5-month guideline. This is to better fight off the Omicron variant. So from 5 to 3 months. The meeting this morning also noted a recommendation by Dr. Liana Wen, a visiting professor from George Washington University in the United States, that cloth masks alone are not inefficient in protecting people from Omicron, and that they should be worn on top of the surgical mask. Additionally, the meeting took note on the current global situation, where the daily number of cases reported worldwide has decreased from 900,000 plus on Friday to 300,000 plus today. Now, Thailand currently is ranked 24 in the world in terms of the number of cases. An update on the Thailand Pass system. As usual, we monitor the number of incoming travelers and trends in imported cases. So we've logged a total of over 700,000, to be exact 701,496 applications on the Thailand Pass system for entry into Thailand. We'll have a slide coming up for you. And during the period between the 1st to the 26th of December, so up until yesterday, for the whole month of December up until yesterday, we have tallied a total number of 240,227 travelers entering Thailand. And of this number, we have a big majority, over 204,000 travelers entering via the Test and Go or quarantine exemption scheme, over 31,000 travelers via the Sandbox scheme, and 1,266 through the 7-day quarantine. We have over 3,200 via the 10-day quarantine and 529 via the 14-day quarantine. So that's a total of over 5,000 travelers entering via the quarantine as per our most current measures. And of course, the temporary pause of the quarantine free scheme. Now, for those who already registered in the Thailand Pass system under the Test and Go and under the Sandbox program before the 22nd of December, if you recall, that was the date wherein we temporarily paused the suspension of the Test and Go scheme. So those who have already registered in the Thailand Pass system under this Test and Go before that Tuesday, the 22nd of December, are still allowed to travel to Thailand under their original travel plans. And if you have not received the QR entry code 7 days in order for the system to review your application. That is, of course, if you registered in the Thailand Pass system before that cutoff deadline, the date of 22nd of December. So in terms of the quarantine, allow me once again to clarify about the different quarantine schemes and number of days of quarantine. You have that infographic on screen for you: 7 days, 10 days, and 14 days. I think this is really relevant for international travelers coming into Thailand. There were questions about the clarity of this as well. So on the 7 days applies to 7-day quarantine applies to travelers who have a certificate of vaccination to confirm that they have been fully vaccinated with approved vaccine for at least 14 days before traveling to Thailand. 10-day quarantine applies to travelers who do not for those who do not have a certificate of vaccination. And 14 days applies to travelers from African countries other than the previously designated high-risk countries, the list is constantly being reviewed. And on the chart infographic on screen there, you have the required COVID testing. Now moving on to the top 10 countries for incoming travelers. Currently, we now have top coming from Germany, the UK, Russia, Singapore, US, Sweden, France, UAE, Republic of Korea, and Australia. Out of the total number of travelers, it was found that 737 tested positive for COVID, or 0.31%. This reflects, of course, the measures that we have, because this percentage is relatively low in terms of the total number of people entering Thailand. As New Year's is approaching and gatherings are of course expected throughout this week and over the weekend, the airport, Suvarnabhumi International Airport, expects to handle almost 50,000 passengers per day, and therefore it has prepared facilities, staff, as well as cleaning services to cater to the surging number of passengers expected to arrive. On the vaccination progress in Thailand, as we mentioned last week, we have now surpassed the benchmark of vaccinating 100 million doses of vaccines in Thailand. And more than 70% of the population have now received at least one dose. So yesterday, and you see on the chart there on screen, we administered over 120,000 doses, increasing the accumulated number now to over 102 million doses. As of yesterday, 26 December, we have 70.8% of the population in Thailand who have received their first dose, and 63.1% having received their second dose already. And turning to the general situation, we have new confirmed case today standing at 2,437 cases. Compared to new recoveries, we have 3,845 recoveries. So new recoveries much surpasses the number of new confirmed cases. That's good to note. Active cases continue to decline. Cases still being treated in hospitals continues to decline. Now it stands at over 34,000 active cases. You see that in the green box on top. New fatalities, of course, also continues to reduce each day, which is very good news. We have recorded for today 18 new fatalities. So our condolences goes out to the family of those who passed away. The average daily number of cases over the past week stands at 2,622 cases. That's the average daily, which is actually less than the average of last week. This, in one sense, shows a good sign, is a good sign that we're going down to 2,000 plus per day. Now comes the serious news, Omicron. Of course, Omicron variant is something that hit us by surprise. It's something of focus around the world now, and we continue to be very, very rigid in our measures to prevent a surge or the entry of the Omicron variant into Thailand. So the latest information is that, according to the Department of Disease Control, Thailand has now detected 514 cases of the Omicron variant. This distribution of the Omicron cases in Thailand has been found in various provinces around the country, in every region in Thailand as well. The number stands at 514. We're hoping that it will not increase in the days ahead. In terms of the provinces, I have some numbers for you here. For example, the Omicron cases in the province of Lamphun stands at 4. In the cluster provinces of Kalasin, Khon Kaen, and Mahasarakham, a combination of these three provinces, there has been found 125 Omicron cases, 125 in these three provinces, of which 97 are pending confirmation. In Udon Thani, for example, 6, Surin 1, Krabi and Phuket province 2, Pattani 7, and Bangkok 2, which means that Omicron has pretty much begun to spread to every region of the country, but it still stands at over 500. The majority of patients with Omicron have no symptoms or mild symptoms, and less than 5% of the patients have pneumonia-like symptoms and severe symptoms. Of the 41 cases of Omicron with symptoms, the majority, or 54%, has had cough, and 10 out of the 20 cases improved within 24 to 72 hours after taking medicine, favipiravir. Also, during the 24th, Christmas Eve, until the 26th of December yesterday, in here we had 698 samples of COVID-19 tested for different variants. Of these samples, 55.4% were found to be Delta variant, and 44.3% were found to be Omicron. This comprises 333 samples from incoming travelers, whereby around 43% were found to be Delta and 56%, the majority, were found to be Omicron. Now, for the other remaining 365 samples in Thailand, the majority were found to be Delta and around 66%, and the rest, 33%, were found to be Omicron. Now, as we know, of course, Delta in the past weeks remains to be the dominant variant in Thailand. But according to the numbers that I had presented to you just now, this trend may be changing. You can see that the percentage of incoming travelers who were infected, we have the majority to be Omicron. But the samples tested in Thailand, for those already in Thailand, the majority were found to be of the Delta variant. So still now Delta, but it might be changing soon as the dominant variant in the country. And the CCSA will continue to monitor the reports on Omicron and other variants in order to adapt the measures as necessary. In terms of the fatalities mentioned just now, a downward trend with less than 20 fatalities. We have 18 fatalities today, to be exact. Of this number, 14 cases, or the majority, are elderly, and 3 cases with underlying health conditions. We have 14 cases reported today were those who were unvaccinated. In the Thai language summary, Dr. Apisamai also showed us a slide on the case fatality rate in Bangkok from April to November 2021. Now, regardless of Omicron, the high fatality rate among the elderly aged 60 years and above at 14.6% fatality rate in June and 10.55% fatality rate in August. The CCSA continues to encourage everyone to get vaccinated and to get booster shots as soon as possible, especially the vulnerable groups. Scientific evidence clearly proves that vaccination and booster shots are able to reduce severe symptoms and fatality. And you have some infographics there from the World Health Organization. Vaccination develops immunity from COVID-19 more effectively than getting infected and sick. So for the top 10 provinces with COVID cases, we have that infographic on screen for you. A few days ago, we had Bangkok with the numbers in green, meaning less than the previous day. Today it's red, along with Nakhon, Si Thammarat, and the other provinces in the top 10 list. So with that note, I'd like to reiterate once again that New Year's is just around the corner, and it is, of course, high time for us to continue to be very, very vigilant regarding the Omicron variant. As I mentioned, we had lessons learned actually from the past year. It's been almost 2 years already, when COVID-19 had affected Thailand and the world at large. So we had our lessons learned. We hope that any festivities, any gatherings will be very, very strictly according to the COVID-free measures, COVID-free settings, and to be extra, extra careful during this coming week and the month ahead. So we take note that more festivities and gatherings with family and friends are expected naturally. Please continue to keep your guard up, practicing universal precaution for your own safety and the safety of your loved ones, and also enforcing these strict disease control guidelines wherever you are, wherever you travel, and wherever you go. If you see any breach of this or any lax in terms of the effort of control measures, in terms of wearing masks, in terms of the large gatherings, wherein, of course, ideally there would have to be people showing up with negative ATK results and temperature checks and all of this. So if you see any of these measures not being performed, I think it's very, very appropriate for you to call that out, and of course to encourage your friends and family to take the measures very, very seriously. So I thank you very much for your attention today. I hope you have a very great week, which is the last week of the year 2021. So more strength for this week and stronger health, more strength for the coming year as well. Thank you. สวัสดีครับ